Root canal therapy is necessary when the pulp of the tooth becomes inflamed, infected, or dies. The tooth pulp is located in the pulp chamber, which is in the middle of the tooth. The pulp contains vital nerves and blood vessels that become infected when bacteria invade it. Bacteria is often introduced to the pulp through a deep cavity or fracture. The inflammation or infection can have a variety of causes, such as a deep cavity, a crack, an injury, or many other reasons. If the pulpal inflammation or infection is left untreated, it can travel through the tooth root and cause a painful abscess that results in bone destruction at the tip of the tooth root. You may realize you have an infected tooth because the tooth may be sensitive to hot or cold. You may have pain when you are biting. You may have swelling, or you may be experiencing throbbing or severe pain. You may also be unaware of the problem because you currently have no symptoms. Your doctor may use a rubber dam or another isolation system to make sure the tooth is kept clean and dry during the procedure. Root canal treatment begins by first administering a local anesthetic to numb the tooth so that you are comfortable during the procedure. During a root canal, the pulp is removed from the tooth by making an opening at the top of the tooth. Drills are used to remove decay and expose the canals. A series of files and other instruments are used to clean and shape the canals of the tooth in order to prepare the tooth for a final filling material. X-rays may be taken during the procedure to inform your dentist of the ongoing process. Once the pulp chamber and root canals are cleaned, the next step is to fill the tooth. This may be done at the same time as the root canal, or may be postponed until the next visit depending on the dentist's judgment and the amount of infection. When a root canal is filled, it is typically done by placing a material with a sealer in the canals and a temporary filling placed on the tooth. Remember that the root canal therapy treats the diseased pulp of the tooth, but the treatment is not complete until the tooth is restored to a functional stage. This normally means a crown is required to restore the tooth's natural shape and appearance, seal the tooth, and prevent fractures. A root canal may require one or more dental visits, so don't be alarmed if your dentist asks you to return to complete your root canal treatment. Remember to follow all recommendations and post-operative instructions given to you by your dentist, as this will promote the healing process.